Joining us now to expand on this conversation of coronavirus restrictions and the impact they're having on working-class Americans is nationally renowned forensic psychiatrist, Dr. Carole Lieberman. So, Doctor, right now we are really heavily focusing on this idea of lockdowns because it's something that continues to affect people a year after the coronavirus first hit the shores of the United States. And I just want to reiterate, at the very beginning, the American people were asked to do something that they've really never been asked to do before. Lockdown for an indefinite period of time, originally 15 days, and they did so. They were courageous in doing so, but here we are, and they're still dealing with this hardship. Do you see a problem in that?
Yes, I see the destruction of America in it. And this has been the worst run public health campaign about coronavirus than I ever have seen as far as a public health campaign. I'm not only an MD, but I also have a master's in public health, and I also was given a grant from the National Institute of Mental Health to study epidemiology, how to use the media to help people prevent and treat illnesses. And what you are supposed to be doing, like Public Health 101, is you don't threaten people, you don't punish people, you give them positive things, positive steps that they can do to help themselves, to take control of their own health. So this has been the reverse, and this has had, in fact, a backlash, the reverse impact, because instead of listening to these things, we are seeing more and more people are rebelling, and they're purposely going into places where they are more likely to catch COVID.
And you touch on something that's so important, and it's the idea that the people have to have faith in the government and the information that's putting out there for them to follow those types of guidelines. I said before that when the government was saying, you know, we just need to close down for 15 days until we get this all figured out, the American people did so. I went out in the streets. I was coming into work, for example. You couldn't see a single individual, a single business. The American people took that threat very seriously, but they started raising questions when it became indefinite timelines, arbitrary timelines, saying you have to close down your business and we're not really sure when you can open back up. People can't plan that way, correct?
They are arbitrary. They're not based on science. They're not, the governors and mayors are not getting good scientific advice. And, you know, we could see the difference comparing what you just talked about with Thanksgiving. You know, people were saying, the governors, mayors, they're saying cancel everything and stay home and cancel everything. Well, you know, people don't want to live like that. And we saw the example with Thanksgiving when people not only, I mean, it was one thing I was saying people shouldn't cancel Thanksgiving, but even I didn't expect them to be flying in droves. So that just shows the extent that people really want to rebel. And that's also part of why some of these, you know, NIH and FDA and all that, they're surprised that so few people want to take the vaccine. It's the same thing. They are rebelling. You know, they thought, oh, wow, they've been playing up the vaccine for months. And why are people not as excited to get it, aside from, of course, the possibility of side effects? But it's because, you know, they don't want to listen anymore because the things they've been telling us to do haven't worked.
And I think that there's also a degree of hypocrisy here. For example, I think that it's worth noting that the reason we're seeing a big surge right now is because many people did travel around Thanksgiving. We're about 2 weeks away from that, and that's just naturally what's going to happen when more people go out and travel, meet with other people. But the reason why the people are doing that is because they're being told to lock down, close their businesses, and then they see Governor Newsom, for example, going to the French Laundry, having dinner, and that gives the suggestion that perhaps this isn't so serious. Perhaps I can go to my dinner. Things of that nature. So is there something that's bigger than this, bigger than the coronavirus, but breaking down the trust that people just generally have in our elected leaders who are supposed to be protecting us?
Yes. You know, there have been so many people. Governor Newsom, of course, is a great example. Even Governor Cuomo, he said we shouldn't go anywhere for Thanksgiving, and then he invited his mother and 2 daughters to come to him. I mean, there's hypocrisy all over the place. So people are thinking, well, if they think it's okay to travel or to, you know, have their relatives, their mother come to them, then why shouldn't I be able to do it? We can go back to work today. We could have gone back to work months ago, really, if people followed basic guidelines to improve their immune system. I came up with an anagram to help people remember what they need to do every day to build their immune system. I'll tell it to you quickly. The anagram is heal myself. Each letter stands for something people need to do. So H is healthy, nutritious food. E is exercise. A is aromatherapy. L is laughter. M is meditation or calming music. Y is your choice of vitamins or supplements. S is sleep 8 hours a night. E is engage with friends and family and support each other. L is limit your gloom and doom intake. And F is follow your passion. If everybody did these things, basic things, not expensive things, every day, we would be protecting ourselves and we'd feel in control of our health, and we wouldn't have to worry about, what these people, these hypocrites, are telling us to do.
I think that's really good advice because that's something I don't hear enough of when we're talking about this topic. I mean, in the prior segment, I was talking about the adverse health effects that are being caused by lockdowns, such as mental health, depression, drug use, alcohol use, things of that nature. But another part of this conversation that isn't talked about enough either is addressing the underlying conditions. People still need to go out, for example, and exercise. That's one way to help combat the symptoms of coronavirus, the same way as eating healthy, all the things that you just laid out right there. So I think that's very good advice for people to be taking into the holidays, especially as I know that more people are going to be traveling for Christmas than perhaps should be, but as we just laid out, it's hard to blame them sometimes. Dr. Carole Lieberman, I really appreciate you coming on the program tonight and breaking down this very complex issue. Thank you.